Hello, I'm Dr. Ruth Roberts, your pet's ally. I hope you are well. And I really hope that you are not experiencing what I'm going to talk about today with your pets, and that's kidney disease. And for some reason, kidney disease becomes a problem pretty early. And it's really tough to really early in life for some animals, much later in life for some animals. And it's a problem because we start to see it for some reason around, with more frequency that is, around the first of the year. And so I'm not quite sure why that is, but it does seem to be the case. So what we're really talking about today is my pet's been diagnosed with kidney failure. Now what? So the first thing I want to put out there is, are you sure your pet really does have kidney failure? And the reason I'm saying this is that many veterinarians, they see the creatinine come up a little bit, they see the SDMA value come up a little bit, they see some other things, and they tell you your pet has kidney failure. Most of the time, they don't. So there's this organization called the International Renal Interest Society, and they put out some staging guidelines. And so I want to take you over to their page so that you can get some information, and I'm going to put the link up for the screening guidelines in just a couple of minutes. But so we're at the IRIS page, iris-kidney.com. And here's the thing I want you to keep in mind. These folks do publish some guidelines about, okay, now we have these numbers increasing, and now what do we do with this? Here's the thing I want you to keep in mind. So here's the members of IRIS, and the International Renal Interest Society was created to advance the scientific understanding, yada, this is all good stuff. Here's what I want you to understand. With the support of Novartis Animal Health, which was acquired by and now is supported by Elanco Animal Health. So this is it. This is an industry organization. They're providing the funding, and while Elanco does not produce the SDMA test, which I'm going to talk a little bit more about in a minute, IDEXX does, they do have drugs that are used to support kidney disease, most of which are intense in converting enzyme inhibitors. So this is just, it is what it is. So unfortunately in veterinary medicine, there is not money available for science for the sake of science. So this is where something like the diabetes group or the kidney failure group would put money behind research. Unfortunately, industry has to do it for much of us. But it is led by a board of 15 veterinarians with expertise in nephrology, many of whom actually speak for Eli Lilly or Elanco. So again, I want you to take everything with a grain of salt here. It's not that this isn't the absolute truth. This is a set of guidelines. The problem is that in veterinary medicine, we just don't have good options as far as what do you do besides feed the bag of prescription food. So we'll pop over to the staging guidelines. And so this is their staging based on blood creatinine and SDMA concentrations for dogs. And there is another page for, actually they've put the combo on here for dogs and cats. So they're generally split off by dog and cat. Now I keep mentioning creatinine and SDMA. So blood creatinine is the level of creatinine in the bloodstream, and this is a waste product that the kidneys are supposed to get rid of along with blood urea nitrogen. That's really come out of favor to monitor because BUN goes up and down with hydration or dehydration, so it's not as reliable. And we can see dogs and cats go into the hospital with profound dehydration from, say, a really horrible episode of diarrhea and have the BUN and creatinine be elevated. Now, most veterinarians are smart enough to say your dog's dehydrated, and once it's rehydrated, it's probably going to be okay. But it's of value to follow up on that. Now, there's two levels here for the blood creatinine, micromoles per liter. That's the values that are the not a value, but the units that are typically used in Canada and Europe. And then in the United States, we generally use milligrams per deciliter. For dogs in the US, creatinine less than 1.4, cats less than 1.6, and I think that used to be 1.9. And then here's the SDMA value. Now, SDMA is an interesting thing. When this test first came out, anybody that had an SDMA over 14 was considered to be in kidney failure, and now it's saying less than 18. And these values, this will jump around to some degree based on other things that's going on, such as not being able to concentrate the urine, things of that nature. So at any rate, I want you to be aware of this, because here's a basic way to say, okay, my pet's in stage 1, stage 2, stage 3, stage 4, and then they can chunk it down a little further based on what else is going on. Is there protein in the urine? Is there elevated blood pressure? So there's a couple of different things in there that may, even though your pet's creatinine may be 1.5, your dog's creatinine is 1.5, if they've got elevated blood pressure, that's going to put them in a higher stage iris failure. And then also on the IRIS website, there are treatment recommendations. And here's the other thing I want you to understand. There's two categories. One is those that slow the progression of chronic kidney disease and preserve function, and then is where the quality of life, we're seeking to improve the quality of life for the pet. Now, the thing that's important to realize is that not until we get into stage 3 disease, and I'm going to scroll back up to this page here, there's generally very mild clinical signs or absent signs in stage 1 and 2 and through much of stage 3 as well. This is the thing that just used to drive me insane in practice, is that people would come in with their pets diagnosed at stage 1 or 2, and their veterinarians had told them, your dog's in kidney failure or your cat's in kidney failure. What can I do, doc? Well, just feed it the prescription diet and we'll wait for things to get worse. And really, in this system, there isn't much else to do except for to add in things like fluids, the calcium inhibitors. Calcitriol is actually often used to help improve function, and several other things like that. So really, in this model of treating kidney disease, we are waiting until things go south further. And to me, that doesn't make a great deal of sense. I don't know about y'all. So there's a couple of other things I want to point out for you as well here. So again, as I mentioned, SDMA, that stands for symmetric dimethylarginine, which is a marker for inflammation as well as for kidney dysfunction. So if your veterinarian tells you that your pet is in kidney failure because its SDMA is elevated and it has a horrific skin infection, that's not necessarily true either. So if there is evidence of inflammation, joint pain, leaky gut syndrome, things of that nature, and the SDMA is elevated and that's it, chances are good that what that test is measuring is inflammation. Okay, so now I've got you a little bit more information. And so third, now what do you do? Again, most of the evidence that's starting to come out in veterinary medicine is showing that chronic inflammation is often the cause of chronic kidney disease. So the first thing you want to do is control inflammation as much as possible. The more inflammation that is present, the more advanced glycosylation end products, or AGE appropriately, get deposited on the basement membrane of the nephron. And the reason I'm telling you all these big words is that is what creates kidney scarring. And so if we can control AGE, or age, getting deposited on the kidney, then we reduce the damage to the kidney. So the other thing that's going to be important is, again, controlling inflammation. Does your pet have a leaky gut syndrome, i.e. does it have periodic times of vomiting, diarrhea, things like that? Has it had chronic infections? So one of the things that you can do to really help is fix the gut, and there's a boatload of ways to do that. For me personally, I like to use a rotation and elimination diet. I think using high doses of fish oil, high doses of probiotics have also been tremendously beneficial. And then the second thing is to feed an anti-inflammatory diet. Now, many raw feeders will claim that raw food has cured their pet's kidney disease, and I believe it has because they've taken out those highly processed grains from the diet, which are really pro-inflammatory. But I personally believe that cooked food is a better option because it provides more phytonutrients from the plants, from good veggies, more water, and lower protein levels. So it's never been shown that a chronic high-protein diet will cause kidney failure, but does a moderate protein diet slow the progress of the disease? Yes, it does. Now, notice I said moderate and not low protein, which is what's in most of the prescription food. I think low protein diets end up creating muscle wasting, which is not going to help our elderly pets because they become more unstable. So that's super important to reduce inflammation by multiple means. Now, the third thing is what happens when your pet goes from stage 2 or 3 to 3 or 4 and starts developing symptoms. They don't feel good. And so what's the thing that your veterinarian recommends? Intravenous fluids, subcutaneous fluids. Why don't we increase their fluid intake before things really go south? And again, this is where a cooked diet really becomes important. If you're cooking for your pet, you're adding a terrific amount of fluid into their diet, and in doing so, you're helping the kidneys decrease their workload by flushing things out. So that's my kind of quick and dirty take on it. And I've got a free kidney support protocol available in the free portion of the members area. I'm going to put a sign up link for that here. But go check it out. I think that really will make a big difference for you and your pet if you're just starting to struggle with this issue. If you got told your pet has kidney failure, chances are good you hopped on the internet and freaked yourself right out, reading about all the stuff that happens as overt or late stage kidney failure happens. Here's one other thing I want you to remember. In cats, there are better studies about how long will my pet live. So to give you some frame of reference, for cats in late stage 2, early stage 3, the average survival time is something like 1,100 days. So that's well over 3 years. In dogs, we don't have as good information. For stage 1 kidney failure, or kidney disease, I should say, the statistics out there is greater than 400 days. Not a range, anyway. So once they hit stage 3 disease, survival time is something like 285 days, and then stage 4, which is overt kidney failure, pretty short. Clinically, I have not seen that to be true because I think we're doing some things differently that most conventional practitioners don't. But that's what I want you to understand. It's not a death now for you, and you're right off the rip if your pet has early kidney disease, stage 1 or 2, and there are a lot of things that you can do. So I hope that was helpful. I'll be back next week. We're going to talk a little bit more about cancer because unfortunately that's the other thing that comes up at the first of the year. So until next week, remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally. Take good care. Thank you.